Hey y'all, it's Smiley. Everybody knows me as Chanel, but you can call me Smiley. Where have I been? I haven't talked to y'all since like Sunday or so. As you can tell in my voice, I'm sick. I have a sinus infection. It really kicked in yesterday, but I was stating before that I felt like something was going on with my sinuses, and my sinuses were causing me problems and whatnot. Yeah, it finally kicked in. I don't have any fevers or anything like that, but I could smell. I have a foul smell in my nose. And my mucus smells the same. Which is a clear indication of an infection. I keep getting sharp ear pain. Everything's on the left side. Um, it's draining. I will say that it's draining. Let me move that back a little bit. It's draining and whatnot, and it's a lot to deal with. So Sunday, I was saying my tooth was draining. I went to my oral surgeon, Dr. Marsh, on Tuesday. I called them on Monday. They said they needed me to come in. On Tuesday, I went in. He said everything looked good and whatnot. Their main thing was to see if I had a hole going from my tooth to my sinuses, because tooth number 14, which is back here, is actually, like, if you actually see, is directly connected to the sinuses, and I actually hurt pushing on my sinuses. And so yeah, I've been kind of going through it. I was still nauseous and everything like that. I have been able to eat a little bit more, but not much. Still very much so on solids and taking pain meds and everything, mainly because my sinus infection. And he told me on Tuesday that the removal of the lower bottom of the lower back is always the most painful. And then, it doesn't help that whatchamacallit, that I have a sinus infection and problems going on with my sinuses. So I ended up going over to Express Care today. Dr. Marsh did actually prescribe me an antibiotic and whatnot. I kept forgetting to pick it up. I picked it up yesterday and whatnot and started taking it. But I did go over to, I went to the ER. I went to West Penn yesterday after I picked my kids up. We were there for 2 hours and didn't get triage. Didn't get triaged. I think we got there at like 3 something. We left at like 5. I'm like, I'm not sitting here. Sorry if you see me like wincing and everything like that, because this does hurt. Like my cheek hurts so bad. Like, so with the sinus infection, sidebar, with the sinus infection, it is causing my face to swell. And yes, it is natural tan. Whatchamacallit. So went there, left. This one lady that was there, she stated that she had been there since 1 o'clock, and she got triage at like 4. No, thank you. No, thank you. I'm actually thinking about if I should pause y'all because I gotta blow my nose. As you can see, yep, my redness and all that. My nose, the outside of my nose, and my upper lip are raw. I actually broke skin on my left nostril, on the outside of my left nostril, so it started bleeding. Got my glasses on because I have eye pressure and whatnot, and all the mucus and everything was getting to me, so I was like, let me just go and throw my glasses on. I got some on my shirt. I have to constantly blow my nose. Like, my nose broke down in 1 day. Yes, I had sensitive skin, but yeah, it broke down in 1 day. My throat is sore. That's like starting today. Like, my throat is sore. And like my glands, like right here, are like kind of starting to swell and whatnot. My throat's turning red. I keep getting sharp ear pain. Like I've had fluid in my station tubes for over a year now. Probably like close to like it's been like a year. January made it a year. I'm going to ENT for that, but that's not until April. We're going to talk about these sinuses too. Because my sinuses, as I've mentioned, I've had problems with my sinuses for darn near my whole life. whatchamacallit is, so my ear is like muffled. My left ear is like very muffled right now. Like I really can't. It seems like I'm talking out of one ear. Like I can only hear out of one ear right now. And so that's what has been going on. The mucus is like super, super nasty. Let me show you how you know you got an infection. I'm going to pause it while I blow my nose. And I'm going to show y'all. And I'm going to let you know when this video starts back up. It's going to be a little nasty. Because I'm going to show you the mucus to let you know you got an infection. Alright, so I didn't get much out. It's kind of clear and whatnot. But, and it's like going further back. But do you see this? I don't know if y'all can see that. I'm going to bring it up a little bit closer. This is how you know you get an infection. You see how it's like yellowish and greenish and like a little brownish. And hold on. This is, here we go. This. Hold on, wait. It's not focusing or something here. There you go. And that's how you know you got an infection. That right there. Yep, it looks like a whole freaking infection. And let me tell you, this thing stuff that happens. It smells so bad. Like, if you've been around somebody that had their tonsils and their noise out, and it's like at that scabbing stage and how bad that smells, yes. That's exactly what it smells like. Or like if you're driving and the window's down and it's the summer, excuse me, and you be like, oh my goodness, what's that smell out of nowhere? And it turns out to be roadkill, like rotting flesh. That's exactly what it smells like. It's terrible. It's terrible. And then to constantly smell it. Hold on. Okay, so I had to blow my nose again. This is what I mean. Constant nose blowing. I got on a wireless bra and I wear a 36 double D. So yeah, this looks crazy right now. So yeah. So that's where I've been. That's what's been going on and whatnot. And I never actually showed y'all what I look like standing up. Like, you know, as far as like, you know, my belly and whatnot. So let's just go ahead and do that because I think we're about to wrap up this dental series and whatnot. Oh, when I was at the ER, they did mention that I have to watch my temperature because they said there are very thin walls with your sinuses and everything like that, and like in that area where I got surgery and where I now have an infection at, that will actually leads to your brain. And they said if you start getting a fever, even if it's the slightest one, you have to go to the ER and wait to be seen and whatnot, and like and actually hang out there because that means the infection has traveled. And we all have heard the stories of somebody dying, like, you know, from like having a dental infection or leaving a sinus infection untreated. Yes, it will travel very quickly. The smell is actually, the smell that I keep smelling and the smell of my mucus and everything is my body, my brain already telling my body to let me know that I have an infection. So yeah, I definitely have to watch out for it. So yeah, back to what I was saying. I'm sorry, I'm looking at my laptop. I'm working from home right now. Back to what I was saying. I never showed y'all my belly or anything like that. So yeah, we're probably about to wrap up this portion of the dental series. Because you know it's just gonna be on and off recovery. I'll update as if there's any changes that I say, and everything like that. And then in a couple months I'll come back with the dental stuff. To let y'all know how that's going. That won't be till May. I have my appointment scheduled for May to go back because it's I had to go back in 3 months to so they could check over everything to make sure the bone grafts worked and whatnot, and to make sure now we need to really make sure that there's enough space on the left side that my sinuses haven't pushed down the space. They need enough space for the screw to actually fit. So hold on. Alright, so that's nose blowing. Alright, so I'm gonna go ahead and stand up and show y'all my belly. Don't come for me, alright, y'all. And I ain't got no butt or nothing like that. Alright, so this is why I need the belly done and whatnot. So this is the belly. You know, it's this is excess skin up here, and whatnot. And here, let me back up a little bit. I'm in my kitchen. Well, kitchen/dining room. That's my kitchen here. I'm standing in my dining room. So this, everything here down, that's penectomy. Yeah. Yeah, wonderful C-section. This is what happens. And this is also excess skin. Let me move my boobs up a little bit. So this is also excess skin. Here, let me just show you. So this is excess skin up here and whatnot, and so that has to get removed. I do have a wider rib cage, so my ribs are like literally right there. Of course, we were doing hip to hip. I think, yeah, it's hip to hip. I don't know if he's going to go around a little bit more, but I do want to lose a little bit more in the process and whatnot, to make it, everything flowing smoothly. My arms. Yeah, I got potatoes on the arms. I gotta get that going before surgery too. So this is like the back view, little raw hair, and this is what he was saying. This is what my plastic surgeon was saying, where he said he wanted me to turn this out a little bit. So I'm gonna go ahead and turn that out a little bit prior and whatnot. Let me pull in my pants or my leggings or whatever. But so yeah, there's the back view and whatnot of how everything looks back there. I just realized these leggings may be a little see-through. Oh, I used to use used to wear the Forever 21 leggings from back in the day. So yeah, this is going on with the belly and everything like that. So yeah, it's like, it's not that bad. Let me do a pull in. See this, all of this is excess skin and everything like that. The question is, because the stretch marks, so like this is like the top of my ribs right here. The bottom of my ribs come down to here. This is my hip bone. I literally have this much. I have like maybe an inch or two between the bottom of my ribs and my hip bone. I have a very short torso. So just imagine carrying like an 8-pound baby that looked like he's 13 pounds. And then like my youngest son was 8'14", and he'll be 4 in April, at the end of April and whatnot. And so, yeah. So the question is, because my belly button's here, this excess skin's getting removed and whatnot, and everything, below the belly's coming off. It's because as you can see, my stretch marks stop like right here. Yeah, they stop like right here. And of course that's getting pulled down and everything, is if I will even have stretch marks when this is all done. So yeah. So like, yeah, you can see like, what I mean of like, I actually do try to like keep everything in order and whatnot. And so, yeah. But all right, pull my chair back over. But all right, I think that's the end of this video. Just a little snippet. I might actually start vlogging my home buying journey, because that is something I do want to do this year as well. For my birthday. My birthday's in June. Of course, everything keeps hitting me left and right, but Lord willing, Jesus got us and whatnot. And so that's something I do need to do. I pay $1,900 for rent by myself, plus all utilities. It's rough. It's kind of hard out here for a pimp, okay? Shout out to Terrence Howard. So yeah, all right, y'all. I think that's it. All right, bye.